Greetings and welcome. I'm Bruce Ovbiagele, past chair of the International Stroke Conference program and also editor-in-chief of the Journal of the American Heart Association. I'm delighted to have Dr. Shuya Li with me here today. Dr. Shuya Li is professor of neurology at the Beijing Tiantian Hospital and is also the PI of the LAIS study, which we'll be discussing today. Welcome, Dr. Li.
Thank you.
So what's the background to the LAIS study?
Thank you for the question. LAIS study is aimed to assess the efficacy and safety of the neuroprotectant, a novel neuroprotectant named loberamisal. That is a dual target neuroprotectant. And the dual target is for the PSD94 and the GABA. In the preclinical research, we can see that this neuroprotectant may be reduce the brain injury from the ischemic injury. So we go to a phase 2 clinical trial to detect the optimal doses of this neuroprotectant. Then we initiate the definitive clinical trials of the LAIS to have the efficacy and safety of this neuroprotectant.
That's very interesting. So it sounds like there have been so many, of course, neuroprotective studies in stroke that have not done well, over 1,000. You and your colleagues were very bold and brave to go into this and do this, but you took a very important lesson from the STAIR criteria because this agent has two mechanisms, right?
That's
And one
correct.
of the criticisms of previous studies was that many of those agents could only act one way. If you go with multiple actions, you're more likely to see some benefit. And you sounds like you did a phase 2 study that was safe and had maybe some signal of efficacy. And now we're going to discuss the phase 3 definitive study, which was done.
Yeah.
So what was the design of this phase 3? How many centers? What were the inclusion criteria?
This phase 3 clinical trial was a randomized double-blind clinical trials that with the sample size of 998 all over the 32 clinical sites in China.
And the inclusion criteria, what was the therapeutic window and what kind of patients did you enroll in the study?
Yes, for that dual targets mechanisms, we choose the ischemic stroke patients with the 48 hours of symptoms onset. And because they are not only can reduce the exact toxicity, but also they have the fast onset antidepressant and anxiolytic effects that maybe have the effect in the late time.
I see. So that's interesting. So the two mechanisms are, one is really the resisting the injury and trying to improve neuronal recovery, but the other one is also antidepressant and anti-anxiolytic. Fascinating. I see. All right. And so were there patients that could not be included in the study?
Yeah, we included the ischemic strokes with severe and moderate and severe stroke patients that with a NIS score of 7 to 20. And also the patients received the IVT was eligible, but the EVT, we excluded the EVT patients.
So intravenous thrombolysis, you could be in the trial, but if you got endovascular, you were
Yes.
not. Got it. Okay. And how long did it take to recruit these almost 1,000 patients?
No more than 1 year.
Oh, that's amazing.
Yeah, that's the Chinese
Congratulations
speed.
on that. Okay. Oh, well, so very interesting concept and background, very compelling design. What did you find?
Yeah, we have found that the loberamisal can improve the excellent functional outcomes by 13%
Oh, wow.
compared with the placebo. And for the modifying ranking dichotomy,
Yes.
sliding dichotomy, and for the distribution of the modified ranking, we have the consistent results of the primary outcome.
I see. So the primary outcome was 0 to 1 on the modified ranking scale.
Yeah.
And then you also looked at the sliding dichotomy as well. I see. And if I may ask, Dr. Lee, the drug itself, how is it administered? Is it IV and how intravenous? How long?
Yes. The study project will intravenous infusion once daily for 10 consecutive days.
So IV for 10 days. I see.
Mhm.
I see. And so that's a very impressive result. Were you surprised?
Not actually, because the modified ranking score make the signal perfect, but we didn't see the same signal with the early needs change and also the
I see.
Kaiser index.
I see. So no, you didn't see that effect on the NIH stroke skill score or on the Bathel index. I see.
Yeah.
And the effect that you saw on the primary outcome, when you looked at different subgroups, was it consistent
Yeah, that's consistent.
across so age,
Sex.
sex, across the timing, everything
Yeah,
is consistent.
everything.
Okay, so that's very robust and everything. Okay, and no complications between the two, no differences in terms of side effects. Safety was good.
The safety profile was very well.
So a good clinical benefit and safe as well.
Yeah.
So what are the next steps, Dr. Lee?
Yeah, maybe this results is give us the confidence to do a lot more clinical research of the lobecity to deeply develop their neuroprotectants for the stroke patients. And also maybe we can find some biomarkers, some optimal subgroups to have the best improvement of the outcome.
I see.
Mhm.
So are there any plans to do another study with this agent beyond just Chinese patients? That's number one.
Yeah.
And then number two, any plans to try and do a study that also incorporates more patients who get IV and even endovascular as well?
Yes, that's a good question because the LAIS trial is an industry-sponsored clinical trials. So maybe the first step is we have the CDE and FDA approval of these new agents, and then we can do next steps.
That sounds good. Well, I just want to congratulate you. You know, this is an area that a lot of people have tried and not done so well. So this is very promising, and I look forward to further studies of this agent, hopefully to help our patients and improve outcomes for stroke patients. So thank you so much and congratulations.
Thank you.